This is Heliox, where evidence meets empathy. Independent, moderated, timely, deep, gentle, clinical, global, and community conversations about things that matter. Breathe easy. We go deep and lightly surface the big ideas. You know, it's funny. Even though the World Health Organization said the pandemic emergency was over last May, I still see a lot of people wearing masks, like when I'm out and about, especially inside.
Yeah.
It makes you wonder, right? Like, are people just being cautious, or is there more to it?
It's definitely something a lot of people are thinking about. We're kind of in this weird in-between phase now where, like, the official stuff says one thing, but people are doing something else.
Yeah, exactly. So to kind of try to get a better handle on this whole thing, I read this really interesting article from the World Health Network. You know, the WHN?
Okay.
They're like this global health group really focused on science, and the article is called, "Yes, We Continue Wearing Masks. Here's Why. Common Questions Answered." So they're tackling this head on.
Interesting. So they're really diving into, like, the reasons why some people are still masking, even though the emergency part is done.
Yeah, and one of the first things they talk about is this whole idea of the pandemic being over. Like, is it really over? And the WHN is saying that just because the WHN called it quits on the emergency doesn't mean the virus has just vanished.
Right. Like, just because something's not an emergency anymore doesn't mean it's gone away completely.
Exactly. Like, it's still around.
Right. For sure. The virus is still out there, and it's still changing and mutating. I mean, that's just what viruses do.
So that kind of shifts things, right? Like, it's not about mandates anymore. It's more like everyone has to figure out their own risk.
Exactly. It becomes way more about individual choices and, like weighing the risks and benefits for yourself.
And that can be tough, right? Because there's no clear-cut answer anymore.
Yeah. It's definitely more complex than it used to be.
And speaking of risk, the WHN article talks a lot about this idea of transmission chains.
Oh, yeah, I've heard about that.
It's basically like thinking about how the virus spreads, from one person to the next, and how even if you only get a mild case, you could still pass it on to someone else who might get really sick.
Right, so it's not just about you, it's about the potential to spread it to others who might be more vulnerable.
Exactly. Like, you could give it to someone who gives it to someone else, and that person ends up in the hospital or worse.
It's like a domino effect.
And you know what's crazy? The article even mentioned that some doctors haven't totally caught up with the latest science about how COVID actually spreads through the air. Like, they're still kind of stuck on the old ideas. Wow. Really?
Yeah, it's kind of surprising, right? Even within the medical community, there's still this, like, learning curve going on.
It makes you wonder how much the general public really knows about all this.
For sure. I mean, if even some doctors aren't fully up to speed, it's got to be even more confusing for everyone else.
Yeah, and that's why I think this WHN article is so important. They're really trying to lay it all out there and explain things clearly.
Yeah, helping people understand the science behind it all is super important.
And it gets even more intense when they start talking about long COVID.
Uh-oh.
This is where it gets kind of scary.
Yeah, long COVID is no joke.
It's not just about being tired for a while after you get sick. It can have some really serious long-term effects.
Yeah, it can affect all sorts of organs, like your heart, lungs, even your brain.
Plus, there's the brain fog and the fatigue that can just drag on and on.
And the thing is, anyone can get it. It doesn't matter how old you are or how sick you were when you first got COVID.
That's what's so unsettling about it. It's like this hidden risk that we're just starting to understand.
Totally. It definitely adds another layer of complexity to the whole masking debate.
Because it's not just about avoiding a few days of feeling crummy. It's about potentially preventing a chronic illness that could change your life.
Yeah, it's not something to take lightly. That's for sure.
It's almost like this invisible threat hanging over everything, even as everyone's trying to move on from the pandemic.
It definitely makes you think twice about the risks, and it's something that everyone needs to consider when they're making their own decisions about masking.
For sure. But, the WHN doesn't just leave us hanging with all this doom and gloom.
Oh, good.
They actually offer some hope for a future where maybe we won't need to be so reliant on masks.
Oh, that's good to hear. What do they say?
Well, they really emphasize the importance of clean indoor air. Like having good ventilation and filtration systems to reduce the amount of virus floating around.
That makes sense. I mean, if we can clean the air we breathe, that would obviously help a lot.
It's like we need to start thinking about clean air the same way we think about clean water. It's essential for our health.
Yeah, that's a good analogy. We don't even think twice about purifying our water, so why not do the same for the air, especially when we're inside?
Right.
And this whole focus on clean air actually aligns with a lot of research that's been coming out about how viruses spread.
Oh, really?
Yeah. It turns out that ventilation and filtration can be super effective at reducing the spread of all sorts of respiratory illnesses, not just COVID.
So it's like a win-win, right? We could potentially reduce the spread of COVID and other bugs at the same time.
Exactly. It's a much broader approach to public health. And it's not just about COVID either. It's about creating healthier indoor spaces in general.
I like that, like a more holistic approach, thinking about all the ways we can protect ourselves and each other.
Exactly.
It sounds like the WHN is saying we need to kind of move beyond masks and think more broadly about how we can reduce transmission.
Yeah, they're really pushing for a multi-pronged approach, and clean indoor air is like a huge part of that.
I mean, it makes sense, right? If we can clean the air we breathe, that's got to help reduce the spread of the virus.
Absolutely. And they actually spend a lot of time in the article talking about ventilation and filtration systems, like how they can really make a difference.
They even compare it to like basic hygiene stuff, like washing our hands and purifying our water. It's like we do all those things without even thinking about it.
Right, like it's just become second nature.
So why not apply that same logic to the air we breathe, especially indoors where we spend so much time?
Exactly. And the WHN highlights how these respiratory aerosols, those tiny little particles we all breathe out,
Uh-huh.
they can hang in the air for a long time, like hours.
Really?
Yeah, so even if you don't see someone coughing or sneezing, you could still be inhaling the virus they left behind.
Okay, now that's a little creepy.
It kind of is, right? Like invisible germs just floating around.
Makes you think twice about breathing, doesn't it?
Well, it definitely highlights why good ventilation and filtration are so important.
Right, because if we can bring in fresh air and filter out those nasty particles, that should reduce the risk of getting sick.
Exactly. The WHN actually cites studies showing that proper ventilation can reduce airborne transmission by up to 70%.
Wow, 70%. That's a lot. Why aren't we doing this everywhere?
Yeah, it's a good question. I think part of it might be that we can't see air quality the same way we see a dirty surface.
Yeah.
Like it's harder to grasp a concept of something spreading through the air because it's invisible.
That makes sense. But now that we do know about it, I think the WHN makes a really strong case for why we need to start taking it seriously.
Totally. Like just because we didn't focus on clean indoor air before doesn't mean we shouldn't. Now, we've learned a lot, and it's time to put that knowledge into action.
So it's like we're kind of shifting our perspective, right? From just thinking about masks to thinking more broadly about how we create healthier indoor spaces.
Exactly. It's a more holistic approach.
So speaking of changing behavior, one of the big arguments I hear against masking is that people are just living in fear. Like they're scared of everything.
Oh yeah, I've heard that one too. But the WHN actually addresses that directly.
Oh, good, because I'm curious to hear what they say.
Well, they basically say that it's not about fear, it's about making informed decisions based on the evidence,
Okay.
They compare it to wearing a seatbelt. Like, we don't wear seatbelts because we're terrified of getting into a car accident.
Right.
We wear them because they've been proven to reduce the risk of injury.
So it's more about being proactive, right? Like taking steps to protect ourselves before something bad happens.
Exactly. And the WHN even goes a step further and suggests that sometimes it's actually the denial of new information that's rooted in fear.
Interesting.
Like people might be afraid of change or afraid of admitting that the world is different now than it was before.
So it's like they're clinging to the old ways because they're scared of the new reality.
It's definitely possible.
That's fascinating. So it's not about being paralyzed by fear. It's about acknowledging what we know and making smart choices based on that knowledge.
Exactly.
But that kind of brings up another question I hear a lot about kids. Like, don't kids need to get sick to build up their immune system?
Oh, the whole immune training thing.
Yeah. Is there any truth to that?
Well, the WHN actually debunks that myth pretty effectively.
Really?
Yeah, they explain that our immune systems are constantly learning and adapting. We're exposed to all sorts of microbes every day, not just dangerous ones.
Right.
And they make a really good point. Like, we wouldn't intentionally expose our kids to tuberculosis to make their immune system stronger.
Oh, that's a good point.
So why would we do that with COVID?
I mean, it makes sense when you put it that way.
And, a lot of us grew up with this idea that getting sick was just part of childhood,
Yeah.
but the science doesn't really back that up.
So it's more about finding that balance, right?
Exactly. Like supporting our immune systems without intentionally exposing ourselves to harmful pathogens. Which leads to another common concern that the WHN addresses. Does masking actually weaken our immune systems?
Oh, yeah, I've heard that one too. I've wondered about that myself, actually.
Well, the article explains that masks don't create this, sterile bubble around us. Our immune systems are still exposed to plenty of microbes through our daily lives.
Okay.
So masking is really about reducing the dose of airborne pathogens, not eliminating all exposure.
But it's not like we're living in a completely germ-free environment.
Exactly. It's more like putting a screen door on your house. You're still getting fresh air, but you're keeping the bugs out.
That's a great analogy. I like that.
It's about managing our exposure to reduce the risk without completely isolating ourselves from the world.
It's like finding that sweet spot.
Right. Yeah, exactly.
It's interesting how the WHN kind of tied all this together. Like, it's not just about masks or clean air. It's about how we think about normal now that the pandemic has, kind of shaking things up.
Yeah, they're definitely challenging us to rethink what normal should look like.
Like, can we really just go back to the way things were?
They don't seem to think so. They argue that we can't just ignore everything we've learned about disease transmission.
Right. Like, we have all this new knowledge. Now we got to figure out what to do with it.
Exactly. And they even question whether going back to normal should even be the goal.
That's a good point.
Like, they point out that hundreds of people are still dying from COVID every week just in the U.S.
Wow, I hadn't realized it was still that high.
And globally, the numbers are way higher. So for a lot of people, the pandemic is definitely not over.
Yeah, it's easy to forget that when things seem to be getting back to normal here.
And the WHN also talks about how this push to return to normal can really put vulnerable people at risk.
Like people who are immunocompromised or have other health issues.
Exactly. They might feel pressured to go to events or gatherings, even if they don't feel safe.
Because everyone else is acting like it's fine.
Right. And that's not fair to them. They shouldn't have to choose between their health and their social life.
So it's about being more mindful of others. Right.
Exactly. And recognizing that what feels normal for one person might not feel safe for another.
So maybe instead of trying to go back to the way things were, we should focus on creating a new normal.
One that's more inclusive and takes everyone's needs into account.
I like that.
And the WHN really emphasizes this idea of collective responsibility.
Like we're all in this together.
Exactly. It's not just about protecting ourselves. It's about protecting each other, too.
And that might mean making some changes, like maybe we need to get used to wearing masks in certain situations or advocating for better ventilation in public spaces.
Yeah, those things might become part of our new normal.
It's like adding them to our list of good habits.
Right. Along with things like washing our hands and getting enough sleep.
So to kind of wrap things up, what I'm taking away from all this is that the conversation around masks and clean air is bigger than just individual choices.
It's about creating a healthier and more inclusive environment for everyone.
And that's something we all have a role to play in.
The WHN has definitely given us a lot to think about.
And for everyone listening out there, we hope this deep dive has been informative and maybe even a little thought-provoking. As we move forward, let's all try to be mindful of each other's needs and work together to create a new normal that's safe and healthy for everyone.
Well said. Thanks for listening today. 4 recurring narratives underlie every episode: boundary dissolution, adaptive complexity, embodied knowledge, and quantum-like uncertainty. These aren't just philosophical musings, but frameworks for understanding our modern world. We hope you continue exploring our other podcasts, responding to the content, and checking out our related articles at helioxpodcast.substack.com.